Hi everyone, we are from Group 1H. We're gonna do the discussion about feed the cat, milk of milk, and chicken in pain.
Okay, so it will be followed by Snoopy the dog, Felix the cat, chicken and rice, and then last but not least, black pepper sticky. Alright.
Hi, so we're gonna do the discussion about milk of milk. So as we know that Mr. Lim farm is in Kuala Bila, which they brought 40 Holstein cow from the Melbourne, Australia. So what the problem? What can I do summary for this discussion where the problem start when the 7 newborn calf are growing with the some clinical signs which is growing poorly, exhibiting mental and physical retardation. So the factor and possibility that can I give for this problem maybe because of the malnutrition to the calf, also obesity to the cow as well, and metabolic disorder, and the last one is the milk fever. So that was my summary for the milk of milk discussion. Thank you.
So, Louis, I'm going to summarize you about the chicken and rice disease problem. So, in that trigger, they say that there are many chicken die in first 50 weeks, and some of them show head tremor and also lethargic, and their body temperature, also respiratory rate of the chicken are also lower than normal. And from the picture that I see, the sick chicken show retarded growth. So all of this can be due to the deficiency in some nutrient. And from what I think, from what I researched, that the deficiency is about vitamin B1, and also deficiency in protein, amino acid, and also energy that cause retarded growth. And the trigger also asks for what possible diet that have been changed. Maybe before this, the farmer give brand rice to the chicken, then he changed the diet into another else that did not have brand. So in brand they have vitamin B1, which is vitamin that are very important for the chicken growth. That's all.
Okay, that's great. So now I'll share to you about my summary of the smelly urine case. Okay, so basically there's 4 facts there. The first fact will be 5 out of 60 cow they have a decrease of milk production for the past 5 days, and I think this could be because the energy they can't meet the demand for the lactating cow, and or maybe this cow they have consumed some kind of contaminated feed which reduce their DM intake, which support the milk production. And then secondly, I think the second fact will be the cow are losing condition although they are eating their normal ration. So I think that it's because maybe they get a heavy parasite load, or maybe the ration has not meet their needs. And thirdly, the third fact will be the smaller cow they start to tremble and stumble, and I think this is an indication of neurological problem due to injured nerve, or maybe the smaller one they have less energy storage, so they tend to finish up their energy reserve faster. And for the last fact, they have up-to-date vaccination. So I think this automatically rule out any possibilities of virus-related disease. So to conclude, I think it could either be cetosis or listeriosis, because due to the energy supply cannot meet the demand, or due to stress or digestion or metabolism disorder. And the listeriosis will be due to the presence of the listeria in their. So I think that could be one of the possibilities.
Hi, so I'm going to summarize the case of Felix the cat. Yeah, so for Felix the cat, Felix is a domestic shorthair and is 2 years old and is overweight, and he lost his appetite for a few weeks and vomiting for a few days, and yet he has a yellow color of eyes. And then the idea is it may due to the vitamin K deficiencies and environmental stress, and introduction of new diet without appropriate slow waning. And for the differential diagnosis, and we suspect that it could be hepatic lipidosis, cholangiohepatitis, and feline infectious peritonitis and lymphoma. And for the learning issues, so there's some learning issues, for example, any change of the diet, and then the management of the cat, and what type of jaundice is the cat having, and what other clinical signs shown by the cat. And for the action plan, so we will suggest to do further blood tests and abdominal ultrasound, X-rays, expiation of liver, urinalysis, and hematocrit measure.
Okay, next I would like to talk about Snoopy the dog. And the primary complaint by the owner is that the dog having exercise intolerance, and blood and urine sample was taken, and the result shows the signs of hemolytic anemia and also hemoglobinuria. And the possible factors that may lead to these observations are: the first is immune-mediated disease, second, toxins such as drugs, toxic chemicals, and heavy metals. And other than that, also infection by blood parasites such as Ehrlichia canis and Babesia canis. Next, maybe due to microangiopathic hemolysis, which is secondary to severe heartworm infection, vascular tumors, venous torsions, and also disseminated intravascular coagulation. Other than that, it may be caused by metabolic diseases such as secondary to diabetes mellitus, hepatic lipidiosis, and also Rapidi syndrome. And last but not least, it may cause by heritable diseases such as pyruvate kinase deficiencies and also phosphofructokinase deficiencies, which has been found in English Fingers Spaniel, which is the breed of Snoopy.
Okay, for me, I would like to summarize about chicken in pain, which is in this figure 1, the birds are not active, poor feather, and showing signs of lameness. Then have joints of the birds were swollen. So from this sign, I can conclude that the chickens have unbalanced diet, which is lack of vitamin B, that is can cause the lameness and decrease the movement of the chicken. And then poor hygiene management also affect the chicken for not active and have poor feathers. And other than that, this might be happen also due to infection, trauma, degenerative changes, or metabolic disorders. So the main problem is that I found is arthritis. So that's all from figure 1 in chicken.
Right, so we're going to talk about black pepper steak situation. Right, so for the fact they are deteriorating behavior and neurological function, and then the animals seem to be aggressive. The animal also, after that, they move slower, and then thus causing the production to drop to around 40%. So by all the fact that we given, we can conclude that the DBS say that there possibility that this kind of disease is zoonotic disease, which is easily transmitted, and then it could be transmitted by animal product, by absorbing animal product. Alright, so there are a few differential diagnosis, which is the first one is common disease, could be BSE, bovine spongiform encephalopathy, Brucella opertus. The other one is hemorrhagic septicemia, and then last but not least is the metabolic disorder that could be caused by contaminated feed. Alright.